a very good afternoon to everyone. मैं अभी आपकी बातें सुन रही थी and everyone was speaking very correctly since air pollution levels have risen suddenly because of definitely Diwali and then many other factors including it. And we all know इस time पे सबको बहुत breathing issues होता है. In fact, the people who have cardiovascular diseases, they are more prone to getting those diseases at in more critical level when the air pollution rises. So I think this was one of the most apt topics for today. So before I move ahead, I would just like to introduce Dr. Tapan Ghosh a bit. So he's basically graduated from Silchar Medical College with honors in biochemistry. He has worked as principal consultant interventional cardiology at Fortis Escorts Heart Institute, New Delhi, and Fortis. Then also he's the director head of cardiology at the same time at Paris Hospital, Gurgaon. Currently, he is the director and head of cardiology at FHVK. He is well versed in coronary intervention and cardiac electrophysiology and device implantation. Dr. Ghosh is the author of Handbook of Lipidology. He was awarded the Cardiologist of the Year 2014 by Indian Healthcare Summit and Awards. So with this, I would just like to hand over the session to Dr. Tapan Ghosh. And with this, I would like to welcome once again Dr. Tapan Ghosh for being with us today. Thank you, sir.
Okay, thank you for your kind introduction. Good morning, everyone. I think we are again here for interaction, and today what I'll do is I'll take you through is my screen is seen?
Sir, if you can enlarge your screen sharing, that would be great. Yeah, now it's visible. Yes.
So I'll be speaking on winter a little bit, and the air pollution and the cardiovascular disease. As you know, winter months are months where a lot of increase in the incidence of cardiovascular diseases are seen. So briefly, I'll touch upon that, and followed by the winter month in relation to air pollution, which is a burning topic worldwide, not only in India. I'll be addressing that, and how does it cause and what we can do. That's what is our topic. Now, heart disease, if you look into the pollution, pollution is linked to heart disease, and it is responsible for 29% of deaths in lung cancer, 24% of strokes, and 25% of death from heart disease, and 43% of deaths from entire lung disease. So smokes are bad for all the organs. Now, during the winter month, in a patient who is prone to heart disease, like a patient of high blood pressure, a patient of diabetes, they should take precaution, because the winter months is associated with higher incidence of vascular events. Why more vascular events? Because the peripheral vascular resistance, because of the higher temperature, is high. And peripheral vascular resistance high means the vessels are prone to rupture. As a result, there are more incidents of vascular events. Two incidents are quite high. One is your stroke, second is heart disease. And third one, which is higher, is GI bleed. That means bleeding from the stomach, etc., also higher. So all the vascular events are higher during the winter months. So what we should do, we should take adequate precautions. Winter clothes, warm up at home before you go out, have adequate fluid, hydrate yourself, because dehydration precedes vascular events. So hydration, adequate clothing, and take your medicines regularly. And those persons who are prone to overweight or obesity, or who has a weight issue, they should be very, very particularly careful, because the winter months our activity level goes down and we tend to eat much more and burn less calorie. As a result, we gain weight. So you have to take care. All the patients with diabetes should take care during winter months, because the diabetes is associated with higher vascular events during winter. Plus, the control of diabetes becomes off target, HbA1c very often shoots 7, and fasting blood sugar very often shoots 140, and PP blood sugar very often goes beyond 200 in these patients. So one should be careful. So that's in the nutshell about the temperature in winter months and the heart disease. Now coming to the air pollution, I'll be stressing much more on this, and I'll show you why it is so important worldwide, why people are really making you and cry. If you look into various causes of heart disease globally, air pollution ranks, second to tobacco smoke in terms of vascular events, contribution of air pollution versus other risk factor, global mortality. So look into the Ebola, road accident, malnutrition, alcohol, AIDS, tobacco, and air pollution. So it just close to tobacco smoking. So air pollution is close to tobacco smoking. If you look into the leading cause of death worldwide, heart and circulatory disorders are the leading cause of death, followed by cancer and respiratory disease worldwide. And high blood pressure is number 1. Smoking, high cholesterol, obesity, and air pollution also somewhere fits in here. Air pollution likely increases the risk of both CVD and other risk factors because it is additive. Now, what are the sources and what are the composition? Natural phenomenon like volcanoes, wildlife, land dust, etc. Human sources like carbon monoxide, sulfur dioxide. Secondary pollutants, ozone is generated by the reaction of volatile hydrocarbons with sunlight, carbon monoxide, carbon dioxide, nitrogen dioxide, and nitric oxide. These are all the pollutants. This slide is very important to have an idea what we mean by PM2.5 and PM10 particle. Very often you see pollution, we all talk about air quality index and PM2.5 particle, PM10 particle. Now hair has a 100 micron diameter. Anything less than these will be there. Pinhead, pollen, cells, red blood cell. One red blood cell is roughly 7 micron, 5 to 7 micron. So half of that is PM2.5 particle. That means 2.5 Coates fraction particles. And PM10 is 10 micron particles. So they are all bigger than virus, than bacteria, than RBC. And half of 2.5 is a half of RBC. Now, these fine particles are very, very small. They are in the air. You inhale them and the body takes up them. It goes inside the circulation. As it goes inside the circulation, it causes inflammatory changes in all the blood vessels. So there is inflammation in the blood. So as a result, this inflammation causes destabilization of the vascular plaque and may cause acute coronary syndrome or acute stroke. So this is a very important slide to understand that particles we are talking about is half of the RBC size, 2.5 and below, and PM10 is 1/10 of the diameter of hair. So these are the particles which are dangerous for human being. Now, if you look into PM2.5 exposure and mortality, as the PM2.5 particle goes high, the mortality goes. So above 5, really sharp increase in mortality, and the mortality goes high up to 5 times. Relative risk increases 5 times. So in the PM2.5 is 50 micron. And just for information, Government of India target of for the India is 60 PM particle. In the US it is less, but we have accepted 60 because we can't afford to accept that 10 standard of US standard because our air is polluted. Acute ozone exposure also increases mortality. PM2.5 exposure and cardiovascular mortality. You can see that, when the ozone is also high, it adds to, higher mortality. And this is a satellite picture of PM2.5. Just look at this. India and Bangladesh, black color, the Bangladesh, and there's India. This is India. So it's a black color. So and black color means it is 70-80 annual PM2.5 exposure. So throughout the year, our satellite picture shows that we are really living in dust. This is the air quality index, 465, hazardous, Anand Bihar, Delhi air pollution control. See, so we are talking about green Delhi and clean Delhi. What we have is here is a 465. We are really smoking a lot. Now, this is just a diagram which will make you understand what we are talking about, the WHO standard, US standard. So WHO standard is 10 and US standard is up to 20 PM2.5 particle, and this is Indian standard 60. So we accepted higher, but at the present moment PM2.5 are much higher than this level. Now how does it do? It causes pulmonary inflammation. That means it causes inflammation in the lungs. As a result, oxidant stress occurs, endothelial dysfunction. That means the blood vessel barrier, the lining of the blood vessel gets inflamed. There is leukocyte activation. That means the WBC, platelet, they are activated. Then there is acute response, and that affects the coagulation cascade. That means the blood becomes more thick. So one way inflammation is there, the other way blood becomes more thick. As a result, there is plaque rupture, which may lead to thrombosis and which may lead to a vascular, either myocardial infarction, or it may lead to a stroke. And in the lungs, it may cause abnormal pulmonary reflexes. There can be cardiac rhythm disturbances because of this problem also. So you can have a heart attack, you can have a brain attack, you can have a cardiac arrhythmia because of the air pollution. And this is how it does. It actually, we inhale it and it goes inside. After going inside, it direct translocation or biological interaction, it goes inside further and produces inflammation, and it causes cardiometabolic disorders. Now, you look into the mortality, etc., cardiovascular mortality. We know that it really evidence is that it increases the cardiovascular mortality. That's how we understand that the air, and this is just the tip of the iceberg. Many things are still being investigated. They are at the bottom of the pyramid, but at the present we know that it causes higher vascular events and increases the death rate. So it was studied in a European cohort, long-term exposure to ambient air pollution and incidence of acute coronary events. That means, does it cause acute heart attack? This prospective cohort study, that means people of European countries, they were followed up. And this ESCAPE project showed that it increases long-term exposure to particulate matter is associated with incidence of coronary events. That means it increases the risk of heart attack. And it increased the risk by 1.18. That means close to 1.2. That means a 20% increase in incidence of heart disease. This data comes from more than 1 lakh participants, 1 lakh patients followed for 11 years. All the European countries were involved. Very large study, and the data is clear that if you are exposed to high PM2.5 over a period of 5 to 10 years, you are at 20% higher risk of vascular events. Heart attack increases, ischemic heart disease increases, heart failure increases, stroke also increases, coronary thrombosis, blood pressure, arrhythmia, all increases. So that means it is bad. So in India, you can see that it is a major problem. And in India also, if you look into the females, particularly in the villages, they cook and they are exposed to a higher ambient particulate matter at home because of the cooking they do, because very often they use the wood, and that causes much more PM2.5 exposure. So India is a country where the village people also are exposed, particularly the ladies are being exposed to PM2.5 particle. So there are a lot of work has been done and ongoing. There is a lot of research on this subject, and it shows that this needs urgent attention, and what we can do at the personal level and local and intervention to reduce exposure to susceptibility to air pollution. fuel, shifting to cleaner fuel, switch off coal filtered power plants to low polluting nearby energy. This is very important. That has to be, and we should switch over to, solar energy or green sources of energy. Transportation reform, promote use of low emission and zero emission vehicle. So that is being done. Reduce sulfur content of motor fuels, restrict trucks from the city centers. This is being already done. Encourage active transport, walking and cycling. This is very poor. Even if you look into our Delhi, we see that the roads are very poorly planned. There is no walkway in major roads. Footpaths are quite narrow. They are occupied by local hawkers, something, or they are broken. There is interruption. No cycling path. So the urban planning has to be redone if we really want to go to the next level. So urban landscape reform is required urgently. Emission trading system, revenue, etc. should be raised where there is air pollution, so that you can indirectly dampen them. Redirection of science and funding, so that has to be done. Empowering civil society, very important, and particularly covering all the free places. So there should be a movement started so that all the barren lands are covered with grass, because we have seen from other studies that from a study from IIT Kanpur last year, that a PM2.5 particle and PM10 particle in Delhi city was related substantially to local dust. That means dust generated from the land itself, barren land itself. So that we have to cover carpeting of the land by grass. Right. Government and NGO-led publicity, etc. should be there. Face mask, and you protect yourself. Face mask and air purifiers, reduce in-traffic exposure, and you can, one of the ways to stop the your vehicle at the red light, reduce in-home penetration of outdoor air, because if the outdoor air comes home, then there is dilution of the air quality, and whatever air purifier you are using, the benefit is lost. And lifestyle changes, exercise, healthy diet, preventive medication, and take care of the conventional risk factors. They are high blood pressure, cholesterol, diabetes, obesity, smoking. One should take care of all these, and this is the basis. So if you do all these things, then probably we can prevent air pollution related CVD. CVD is a major cause of death and disability in India, and mechanism linking air pollution with CVD available from various studies. Air pollution is a major contributor to CVD in India and the world. Evidence in India linking air pollution with CVD is being generated through elegant research. Joint effort by public, government, NGOs, architects, town planners, legislatures are urgently needed to contain the cardiovascular epidemic amplified by air pollution. Thank you. Many things in science are not really accepted initially. Just to give an example, when angioplasty was first introduced, this is the gentleman, and it was not, even his initial presentation was not accepted as a full oral paper. It was given a poster presentation, 1976, Andrea Grunzig. So first angioplasty he did, and it was not even oral presentation, it was a poster presentation. So it is not recognized. 1998, we first from Batra Hospital presented our data for placing a stent in acute heart attack. 98. I was a budding cardiologist at that time. It was rejected. After that rejection, we published this 6 months after that. We had an international publication in 1998. In 2000, Nobel Prize laureate they were rejected, medicine Nobel Prize, and then they were accepted. So many things in science we do not accept initially, later on we accept gradually. So I think this is air pollution, and pollution is that kind of subject. Many people, many societies, many presidents do not accept. And as you know, last US president backed out from the Paris Climate Summit, and this President Biden has joined. So a lot of things are required to be done at both the national and international level, even at the household level. Thank you very much for your kind attention.
Dr. I wanted to just ask you one question.
Yeah.
Wearing the mask, would it be okay to minimize air pollution inhaling?
Yes, it's a personal protection. You should wear mask most of the time.
And what type of mask one should wear it? Can you suggest?
Any mask, 3-layer mask, homemade mask is sufficient. But if we, at the present moment, we do not say that you use N95 mask because it becomes a costly affair. So any mask, which is a 3-layer protection, can be used. Cloth mask, 3-layer, are good enough.
Thank you, sir. Thank you.
Yeah.
Can I ask question?
Yeah. Please go ahead.
I am Mandilwar.
Yeah.
Yesterday I have consulted you, you know.
Yes.
I just wanted to ask you in the morning, how it is safe, how much it is safe to go for walk?
So, can you repeat the question?
How much it is safe for walking in the morning?
Oh, you should go. You should go for walking, but protect yourself with adequate clothes. Hydrate yourself. Take your medicines before you go out, routine medicines, and wear mask. You must go out.
But in the morning, is it safe to go?
No, see, if it's too cold, you should not go. If it's too cold, don't go. Wait, but then temperature varies throughout the day. So we wait for the sun to come, because all of the senior people, they can afford to wait because they don't have to go for, any office work. So they can wait. They can go to 9 o'clock, 9:30, 10 o'clock.
Mm-hmm.
So they can go a little later when the ambient temperature is better. But you must go out.
Yes, sir. That's all right. Okay. Thank you.
अच्छा डॉक्टर साहब एक पॉइंट और भी है अभी इबोहा की तरफ से we all are going on 16th of November to Pratapgarh Farms, which is about 2 hours drive from here and 3 to 4 hours to stay in the farms. Do you suggest that we people should go or we should not go?
I can't advise like this, but see, the issue is if you're going for a day, that's fine, but daily commuting a distance for clean air, I think not justified.
Because tomorrow we're leaving, on 16th we are leaving at 8 o'clock and returning from there at 5 in the evening.
Yeah, that's fine.
And we all in the age group of 70 plus.
No, all of you, if you are physically fit, medically fit, you can go. That's it. Take adequate precautions. So you should be fit both physically and medically.
सर अभी तो सारे हम पूरे 75 वाली एज वाले हैं, कोई ना कोई बीमारी तो है ही है, किसी को डायबिटीज है, किसी की थोड़ी सी हार्ट की प्रॉब्लम है, किसी को चोर है.
See, the human body is prone to decay, right? And you will have some diseases because you have become senior. And Jatasya hi dhruva mrityu, Kathopanishad says. Right. So for that, I can't stop. I might die suddenly on the table. I'm giving a big lecture. I might die suddenly. That I know at the core of my heart, because Kathopanishad said 5,000 years ago that Jatasya hi dhruva mrityu.
Dr. Saab.
Wonderful, sir. Wonderful.
Dr. Saab. Is it good to use air purifier in your house?
Yeah, you should use.
But we can use it only actually in the night time only. Daytime we are going around in the house. So whole house cannot be.
No, you can use in daytime also. There's no harm.
Dr. Saab, I have a query. I'm Arun Malik.
Yeah.
Yeah, shall I? Yeah. See, I'm having little bit of temperature from last 2 days. It is between 99.5 and 100.
I'm sorry, this is not the right platform to discuss your health.
Okay.
I'll address only the general social issue, air pollution related.
Because of the pollution, because of some other factors, because it never goes up, because of change of weather, change of temperature.
Can't say. No answer, please.
Okay.
Any other question rather than just I just like to highlight, let's not do the medical profiling over here. For that, they need to assess a lot of factors to take into that consideration. But in case you want, we can definitely help you in getting in touch with Dr. Tapan Ghosh. But any other case, do you have any other questions? We can address this right now.
Doctor, I have a question. It is relating to how frequently we should clean that N95 mask and how to clean it, because it is costly. No, it is we have heard that it is reusable.
See, N95 masks are, usually we use for 4 days and then throw it.
Okay.
And so what we do is we have like 4 or 5. Today I wear one and we'll recycle. I'll wear the second one, third day, third one, fourth day, fourth one. And the one which I was using on day 1, I will use on the 4th day. And then such cycles, 4 uses and throw it.
No, can we clean at home?
No, you can't.
No. Okay.
Thank you. डॉक्टर, एक बार जब घर में मेड आती है तो क्या हमें मास्क लगाना चाहिए?
सबको लगाना चाहिए, आपको भी लगाना चाहिए, मेड को भी लगाना चाहिए.
लगाना चाहिए.
दोनों को.
ओके, थैंक यू.
डॉक्टर, सर्जिकल मास्क को कितने घंटे लगाना चाहिए एंड फेंक देना चाहिए उसके बाद?
That's the same principle, surgical mask. We always advise, if you're using surgical mask, use 2 masks, double masking, and use the same principle, and then throw it. Don't wash.
After 4 days, we should waste it.
4 uses, 2, 3, 4 uses. If you're not having any fever, no difficulty, nothing, and the mask is clean, then you 4 uses and then throw it.
Doctor, okay. Mask is being used for corona or for air pollution in the house?
Both. Corona is not over. Corona is not over.
Thank you, Doctor.
Okay. I think we have addressed the concerns and the questions.
Yeah, thank you, Tapan Ghosh, doctor, for such one.
जो 3 लेयर मास्क हम लगाते हैं डेली, तो इवनिंग में उसको वॉश कर देते हैं, सफिशिएंट?
हाँ, ठीक है, अच्छा है. कॉटन के मास्क ना?
हाँ जी, कॉटन के डेली वॉश कर देते हैं.
बहुत अच्छा.
थैंक यू.
So, thank you, doctor.
Thank you, everyone, for joining us today. With this, we have come to end of the show, and thank you, Tapan Ghosh sir, for joining us today.
Thank you so much.
It was indeed an informational session. Thank you, everyone.
Thank you, Doctor. Thank you very much.
Thank you.
Thank you very much.